welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and today I'm going to talk about specific alterations in the BRAF gene found that may affect treatment and survival response in adult brain cancers. Researchers have identified a range of genetic alterations in glioma brain cancers that will help them to understand how different mutations in one particular gene interact with other gene alterations and which ones are more susceptible to targeted treatments in adults. BRAF alterations are important to identify in brain tumors because they can determine treatment. However, it's unclear what types of BRAF alterations occur in adults with glioma and whether specific BRAF alterations are associated with other gene alterations or with a different clinical course. The term glioma covers several types of tumors that originate in the glial cells in the brain. Glioblastoma is the most common type in adults and children, occurring in 3.23 per 1 lakh of the population, and only 7% of glioblastoma patients survive for 5 years after diagnosis. New and better treatments are urgently needed, and drugs have been developed that target specific BRAF mutations such as dabrafenib and trametinib, which inhibit the BRAF V600E mutation. Knowing which mutation or combination of genetic alterations are driving a patient's cancer is crucial to choosing the best therapy that is most likely to prolong survival. The researchers divided the tumors into 3 groups based on how the BRAF alteration activates a signaling pathway called ERK, or extracellular signal regulated kinase, that contributes to cancer. Class 1, Class 2, Class 3, and also gene rearrangements, amplifications, and other unclassified alterations. They found that BRAF-altered gliomas in adults and children had different features. There were more Class 1 BRAF V600E alterations in adults and more BRAF fusions in childhood glioma. BRAF V600E alterations were associated with improved overall survival in adults with glioma, but for the most aggressive type of glioma, that improvement disappeared and increased age was associated with worse survival in these patients. The researchers also found that BRAF V600E conferred sensitivity to targeted therapy in adult patients. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.